Tips for suicide prevention and overcoming mental health struggles. Suicide is the 10th leading cause of death in the United States. Suicide prevention has been a growing concern for many Americans. The suicide rate in males is 3 times higher than females, and it is also higher in middle-aged people than any other age group. The suicide prevention crisis in America has been prevalent for over a decade now, with an increasing number of suicides each year. There are many factors that contribute to this crisis, including mental health struggles and lack of resources for those struggling with suicidal thoughts or tendencies. In order to reduce the number of suicides, we must address the root causes of mental health struggles by providing more resources so that people can get help when they need it most. What is suicide and what are the warning signs? Suicide is a serious mental health issue that has become more prevalent in today's society. The first step in preventing suicide is to understand the warning signs and risk factors associated with it. These are not always easy to spot, but being aware of them can make a difference in someone's life. There are many warning signs of suicidal ideation, which can be broadly categorized into 4 groups. Psychological symptoms: sudden mood changes such as depression or mania, drastic changes in personality or behavior, agitation and anxiety. Physical symptoms: sleep disturbances, rapid weight loss or gain, significant change in appearance. Social symptoms: withdrawal from friends and family members, neglecting responsibilities at work or school. Environmental triggers: traumatic events such as the death of a loved. If you're worried about someone who might be suicidal or struggling with self-harm, here are some tips on how to help them. Ask them directly if they're thinking about suicide; it could save their life. Let them know that it's okay for them to not be okay and that you care about them. Listen without judgment, avoid saying things like "you'll be fine" or "just try harder." Instead, ask questions like "what can I do to help?" or "what can I do to make you feel better right now?" Don't leave the person alone until they seem safe and stable again. How to prevent suicidal thoughts and behaviors. There are many ways to prevent suicidal thoughts and behaviors. One of the most effective ways is to seek help from a mental health professional. People who are experiencing suicidal thoughts or behaviors may need support from a licensed therapist or psychiatrist. They can help you manage your depression and other mental health conditions, which may be contributing to your suicidal thoughts. Another way to prevent suicidal thoughts is to seek support from family and friends. You do not have to go through this alone. Your loved ones want to help you and will be relieved if you tell them about how you're feeling. They can also offer practical advice for how best to cope with your feelings of despair or hopelessness. If you are experiencing suicidal thoughts, it's important not to keep them bottled up inside. Talking about them will make them feel less overwhelming, which can help prevent future suicidal behavior from occurring again in the future.